I was looking forward to having it. It's important for everyone when it's their turn to get a vaccine, because the more people that get the vaccines, the sooner we'll be able to go back to a more normal life for everyone. So that's all 4 that have been approved are safe. I received AstraZeneca today, and I would certainly want everyone who can receive any one of the vaccines at the appropriate time to do so, and anyone who wishes to receive AstraZeneca who's over 60 years of age can receive it at a pharmacy or at primary care providers. So I really encourage everyone to do that. But in the meantime, even though you've had your first vaccine, it's still really important to follow the general public health advice. People still need to maintain physical distancing, wearing a mask, washing hands frequently, and so on. So all of those measures are still as important as they ever were, and I encourage everyone to follow those precautions and get a vaccine.
How important does the pharmacist in Ontario play a role in getting the population vaccinated?
Pharmacists play a huge role, both in terms of vaccinating people in their clinics, in their pharmacies, but as well some of the pharmacists are also doing work in the mass vaccination clinics as well. So pharmacists are a huge provider of vaccines and do it very well. Mine today was painless, so it was great.
And when are you coming back for your second dose?
I'm going to be booking it about 12 weeks' time.
Perfect. Canada is getting a huge number of vaccines from different sources this week. How will that affect Ontario's vaccine rollout?
Well, it means we're going to be able to expand the rollout. Right now, pharmacies only in a few locations are able to provide them, but we're going to make sure that we have 3 pharmacies available in every public health unit region. There are 34 of them, to be able to provide vaccines, as well as the mass vaccination clinics, and of course primary care providers, particularly for people that have outstanding conditions, other issues that people want to check with their primary care provider before they receive the vaccine.
Last question. What advice would you give someone who's maybe on the fence? You can speak firsthand because you just got the shot.
Yes.
What would you say to them, and also why is it important?
Well, I would say please go and get a vaccine. Please do that. Any one of the ones that have been approved by Health Canada are fine. Pfizer, Moderna, AstraZeneca, which I received today, and the J&J vaccine. We haven't received them in Ontario yet, but they've all been approved by Health Canada and by NACI, the National Advisory Committee on Immunization. So I just encourage everyone to go out and do that, because we need the vast majority of the population to be immunized so that we will have that herd immunity, as they say, and that people will be able to go more or less about their normal lives again. So until everyone who wants a vaccine receives one, then we all need to follow the public health advice. But I would really encourage everyone to please go out and be vaccinated.
And last question, so Ontario, we're on the right track.
Absolutely. Ontario is doing very well. As a matter of fact, yesterday we exceeded over 2 million doses of vaccines have been administered. So we've got another number of million yet to go, but I think that's a really good target that we've hit in just a few weeks. So please make your appointment. Please go out and receive your vaccine.
Perfect, thank you. Can I get one picture, just a one shot, just from back there?
Oh, yeah, sure.
Just on your phone, you can just leave it up to me.
Yeah.
Yeah, go for it. Thank you very much.